Optimizing the wound healing environment after sinus surgery is critical to achieving long-term positive outcomes. Chitogel is clinically proven to enhance wound healing and the patient experience. A hydrogel nasal dressing, Chitogel is easy to apply. It stops bleeding in minutes and comfortably coats the affected area, providing significant advantages to patients undergoing endoscopic sinus surgery. Introducing Professor Peter John Warmold, one of the world's foremost sinus surgeons and a recognized world leader in sinus-related technology.
Patient A is a 55-year-old male with a 3-year history of chronic sinusitis. This patient has bilateral significant sinus disease. His CT scan showed bilateral ongoing pansinusitis with large nasal polyps. He was treated with maximal medical therapy, including oral steroids, saline rinses, and nasal sprays, and showed no improvement in symptoms or on endoscopy. I'm going to perform a bilateral full house FES. This patient is part of a clinical study, and the right side was randomized at the end of surgery to receive Chitogel. When we look at the parasagittal scans, we can see that the frontal ostia are very narrow on both sides, and there's extensive opacification of all the sinuses. This is going to make a significantly challenging surgery. When we start the surgery on the left-hand side, you can see nasal polyps present. Once we have opened the frontal ostium, we can visualize the frontal sinus. A complete sphenoethmoidectomy has been performed. The field is quite vascular and there's significant ongoing bleeding. Hemostasis is attempted by cauterizing the sphenopalatine artery region. When we proceed to the right side, we can see polyps medial to the middle turbinate, and when we open the maxillary sinus, there are extensive polyps present. A complete sphenoethmoidectomy has been performed, and we can visualize the frontal ostium. This is very narrow, and there's significant vascularity from the sinuses and polyps. This vascularity leads to significant ongoing bleeding, and we can see that the surgical field is generally oozy. We apply Chitogel through the frontal ostium into the floor of the frontal sinus. We fill the frontal recess. Then we apply Chitogel to the sphenoid sinus. We fill the ethmoid sinuses in a posterior to anterior direction, and then apply the gel around the maxillary ostium. Finally, we apply the gel to the space between the middle turbinate and the lateral nasal wall. It's important to suction any excess gel away from the nasal floor, so if there's any gel between the middle turbinate and inferior turbinate, this needs to be removed. This application results in almost immediate hemostasis. When we visualize the nasopharynx and the ethmoid cavity, we can see there's complete cessation of all ongoing bleeding. Hemostasis has been achieved. When we compare this to the left-hand side, we can see that there's significant ongoing bleeding. There's filling of the sphenoid and ethmoid cavities. The patient was reviewed at 2 weeks. On the left-hand side, we can see significant edema and some scabbing present. The frontal ostium is narrow and there are granulations present around the ostium. On the right-hand side, sinuses are much clearer. There is a good view into the frontal sinus with less edema and patency of the frontal ostium. The ostium is noticeably larger and there are less granulations present. At 6 weeks post-operatively, on the left side we can see scar band formation around the frontal ostium with significant narrowing of the ostium. There's also edema and quite significant scarring of the ethmoid. When we compare this to the side that received Chitogel, we can see that the frontal ostium is nicely preserved, the mucosa healthy, with less scar tissue formation. When we review the patient at 3 months post-operatively, we can see significant secretions now in the frontal ostium, with significantly narrowed ostium and scar tissue bands around the ostium. When we clear away the secretions, we can see a patent narrowed frontal ostium. When we compare this to the right side, we can see a widely patent frontal ostium that is well preserved with healthy mucosa around the frontal ostium and less scar tissue formation in the ethmoid cavity. I like Chitogel for its hemostatic properties. It controls generalized ooze and is great for patient comfort. But probably most importantly, it prevents adhesions and maintains osteopatency. But I'm really excited about the healthy microbiome that it creates, which gives you long-lasting mucosal health.
Chitogel's properties are backed by 10 years of research and clinical evidence. Chitogel nasal dressing, a post-operative solution in endoscopic sinus surgery. Chitogel. Support wound healing. Enhance the patient experience.